Hi, I'm John Fredrickson, and welcome to the ICDP Institute. Today, we're going to give you some tips on how to handle projection. And the first thing you need to remember is that everybody projects at one time or another. And the second thing is that there are different kinds of projection which require different kinds of intervention. So we'll take a look at one of the most common forms of projection. You ask the patient, what's the problem you'd like me to help you with? And the patient responds, I should ask my wife. She's the one who thinks I have a problem. The sigh indicates that the patient's anxiety is in the striated muscles. If you don't know what that means, go back to my first anxiety video where I explain that. The main point here is this. If the patient sighs, the projection serves as a tactical defense, a tactic to keep you at a distance. Don't interpret the projection because you have no permission yet to do therapy. Instead, block the defense, return to your focus. So when the patient says, I should ask my wife, she's the one who thinks I have a problem, you can respond, well, since your wife's not here, I can't help her. So what is the problem you'd like me to help you with? Many times, however, the patient projects and equates you with his projection. Now, he has a misalliance with his projection rather than a therapeutic alliance with you. In these cases, we have to restructure the projection. What does that mean? We have to help him see that you are not the same as the projection. Once he can differentiate you from his projection, he can form a therapeutic alliance with you. So let's take a look at a few examples where projection occurs and the patient has trouble differentiating you from the projection. Let's suppose you're exploring a problem with a patient and the patient becomes hesitant and says, well, I don't want to go into that. I'm afraid of the questions you want to ask. This is known as projection of her will. Let's not forget that the patient came to you of her own free will. She comes to you because she wants help. She wants some answers to her questions. But exploring issues with you triggers her anxiety, and she forgets that these are her desires. Now she assumes that these are your desires, so she becomes afraid of you. She experiences you as an invader, not as her therapist. Thus, we have to deactivate her projection of will, so she's no longer afraid of you, and so she can own her own desire to explore herself. When the patient says, I don't want to go into that, I'm afraid of the questions you want to ask, you can respond like this. Well, let me get clear here. Was it your wish to come here today? And the patient says, well, yeah. And then you could say, and is there a problem you're wanting help with? And the patient says, yeah. And are there questions you want to answer? And the patient says, yes. And then you could say, and would you like to get better information so you can make better decisions? The patient says, yes. And then you could ask, and do I have your permission to ask you questions so you get the information you want? The patient says, yes. Each question reminds the patient of one of her desires. As she remembers these desires and owns them one by one, the projection onto the therapist drops. When the patient's projection drops, she becomes relaxed. You must deactivate this projection, otherwise the patient will be afraid of your questions rather than joining you and exploring her questions about herself. Let's take a look at another common form of projection. We call this projection of the superego. Let's suppose the patient has just talked to you about his rage towards someone who molested him. He's always had difficulty tolerating his feeling of anger, judging himself for it, calling it evil. Now, having felt his anger toward the molester, he suddenly becomes angry with you, accusing you of judging him. So let's unpack this. He felt angry. The anger triggered anxiety in his body. The anxiety triggered the defense of self-criticism. But then he does one more thing. He projects that inner judge onto you. Now he believes you are judging his anger. That creates a misalliance. Because if he truly believes you're judging and condemning him, he'll be unable to form a therapeutic alliance. So we must deactivate this projection to form a therapeutic alliance. We must deactivate the projection so he can see how he cruelly judges himself and his anger. So let's see how to do this. The patient said, well, now you're judging me. You could ask, what's the evidence for that? The patient said, well, I just feel that way. And you could respond, well, of course you do. So it's important to see if there's any evidence to fit with what you feel. So let's find out, what is the evidence that I'm judging you? The patient says, well, it's nothing you said. I just sense it. And you can say, okay, so there's nothing I've said that judges you. So now as you look in my eyes, is there any sense that these eyes are judging you? The patient says, well, I don't know. And you say, well, let yourself look. After all, if I'm truly judging you, you deserve to know so you can protect yourself. So let yourself look into these eyes and let yourself find out. And the patient looks and says, no, they aren't judging me. And you could say, yeah, I'm not judging you. What do you see when you look in these eyes? The patient says, well, it looks like you care. And you can say, well, I do. And how do you experience that as you let yourself take in my caring eyes? As you continue in this way, the patient's anxiety will drop. When it drops, always take the time to clarify the projection. So you would say, so we see that you were criticizing your own anger. But then it's like that thought traveled over here to me, and for a moment you were afraid I was criticizing you and your anger. Do you see that? The patient says, I didn't before. And you say, well, of course. That's why it's important for us to notice this mechanism that's been hurting you, because the self-criticism has been hurting you. And when that thought traveled over here to me, you were in contact with the judge instead of with me. Does that make sense? And the patient says, yes. Then you could say, then when you're relating to the judge instead of to me, that prevents us from having the kind of relationship you came here to have. Do you see that too? Always take the time to help the patient see how the projection interferes with a helpful relationship the two of you are trying to have. And always help the patient see his own self-criticism. When he can see how he judges himself, he won't need to project that judging habit onto you or others. Then the two of you can focus on his internal conflict between his anger and his defense of judging harshly. This is just a few of the ways projection can occur in therapy. If you want to learn more about how to work with projections, visit our website, www.istdpinstitute.com, Psychotherapy Videos, to purchase our psychotherapy video on projection. In it, you'll be able to study an initial psychotherapy session with a patient who projects. You'll learn how to identify different kinds of projections, how and why they occur, and how to address them. In the meantime, I'm John Frederickson, and thanks so much for joining us at the ISTDP Institute.